Welcome to episode 9 of Ask CPS. My name is Janine Chatelier and I will be your host for today. Today we have 3 epidemiologists with us, Slana Van Kampen, Dr. Leigh Bowman, and Ava Lister de Weaver. Ava, what can you tell us about the current numbers?
Hi, Janine. Yes, so as of Tuesday, September 3rd, there are over 500 confirmed cases of COVID-19. This value reflects the number of cases from the onset of the outbreak in March up to today.
Why was the decision made to change the reporting format?
So the decision was made to change the format on request of the Council of Ministers. So the new format is much more simple and displays the following terms: active cases, recovered cases, deceased, and total.
Can you explain the following terms from the chart?
Absolutely. So active case, so this is the amount of cases that are currently being managed by the nurses at CPS. This number fluctuates. So as cases are confirmed, the active number increases, and as persons recover, the numbers decreases. The total, self-explanatory, so this is the amount of persons who have tested positive for COVID-19. Recovered are those persons who are no longer with active infection of COVID-19. And for death or deceased, those are the persons who have sadly passed away where the cause of death was COVID-19.
What happened to the previous format? Is it still available for the public to view?
Absolutely. So while the current condensed version of the table is circulated by government through various social media, the full table with all of the statistics are still available at the St. Martin government website.
This is Ask CPS. Stay tuned.
The following public service announcement brings to you a few of the many unsung heroes in the medical profession who are working tirelessly to put our needs ahead of theirs and in the midst of this battle to prevent the spread of COVID-19. Listen closely to their message so that we all can remain safe.
Good day, General Public of St. Martin. I'm Dr. Felix Holliday, General Surgeon and Medical Director of the St. Martin Medical Center. I'm staying at work for you, so please, stay home for me. Stay safe.
My name is Christina Jacobs-Burkle. I'm the Junior Patient Care Manager. COVID-19 affects everyone. So please, everyone, let's protect everyone and stay home.
Hi, I'm Meandra Hazel, ICU nurse. I'm a frontline nurse and I'm asking you to be a frontline citizen. Please stay home, save a life. Help me to help you.
This public service announcement is brought to you by the St. Martin Medical Center and the government of St. Martin.
Safety tips on how to use your mask. Wear your mask in public places. When removing your mask, properly take your mask off by grabbing the bottom ties of your mask, then the ties at the top, and remove the mask. When disposing the mask, discard the mask in the trash can and do not litter. Safety first. Don't touch your eyes, nose, or mouth until washing your hands thoroughly for 20 seconds. These safety tips are brought to you by Collective Prevention Services and the Department of Communication.
St. Martin has experienced its fair share of hurricanes over the past 25 years, and we faced them all head on. We've witnessed horrific seasons with staggering loss of property, but this year might be the most destructive of all. The destructive power of hurricanes coupled with the debilitating coronavirus pandemic. Where do you run? Where can you hide? Now is the time to prepare. Think about how and where you'll evacuate to reduce crowds at shelters and maintain social distancing. Have a plan for keeping your elderly family members safe. We live in a hurricane-prone area, so start gathering essential hurricane supplies now. Things like plywood, batteries, generators. Strengthen your home as much as possible while you have time on your hands. While preparing for the hurricane season, follow the latest health guidelines at stmartingov.org/coronavirus. And remember, it only takes one to make it a bad season, so make sure you're prepared.
This public service announcement is brought to you by the government of St. Martin.
Welcome back to Ask CPS. We have Dr. Lee Bowman with us. Lee, imagine you are a person exhibiting signs and symptoms of COVID-19. Walk me through what I can expect from CPS.
Sure, no problem. So usually what happens is that person who is experiencing symptoms will need to contact 914 or their physician. They give their details, and in the case they've contacted their physician, the physician will be in touch with us at 914. At that point, a nurse will be in touch with you to assess you against our case definition. And from there, we will issue an isolation letter that will tell you the dates during which you've been requested to isolate based on your symptoms. And at that point, you should also inform your work insurer as well as the physician. Now, whilst that's happening, we will also request a test for you. And then you will be requested to attend a testing facility somewhere on the island. And then you will also then go back to your home where you will isolate for a full 14-day period. Now, isolation consists of staying in a room, a separate room where possible in your home, so you're not interacting with other members of your household. But where that's not possible, we ask that you try to keep your distance, that's at least 2 meters or 6 feet. Wear your mask and wash your hands. There are other measures that you can also take, such as ensuring that you don't share the same utensils, you change your linen, don't share the linen, and wash your towels regularly and clean down the surfaces with a bleach-based solution as often as you can. Now, throughout that 14-day period, a nurse will be in touch with you fairly regularly, every 2 or 3 days, to see how you're going. And by the end of that 14-day period, the nurse will call you to reassess your situation. And if all is well, you will be released from your isolation period. And at that point, you are free to leave your home and also, importantly, to go back to the workplace once you've informed your physician and then your employer insurer. And finally, it's important to note that you do not need to be retested for this to take place.
Dr. Bowman, imagine I have been in contact with a confirmed case. Could you walk me through the next steps?
Sure. So what would happen is that you would contact 914 if you know that you've been in contact with a confirmed case, or your GP, who will then contact 914 and let us know. But if you don't know that you've been in touch with a confirmed case, which is likely in the majority of cases, we will contact you through our source and contact tracing team. So one of the nurses will be in touch with you, ask you a few questions and ascertain whether or not you have indeed been in touch with a confirmed lab diagnosed case. So when that happens, we will take you through a triage system, and if you're found to be symptomatic, then of course you'll follow the isolation guidelines that we just discussed. But if you're not symptomatic, we will then send out a quarantine letter requesting that you quarantine for 14 days. The letter will state the dates during which you need to quarantine. And at that point, you should also inform your physician as well as the employer insurance to let them know. Throughout that period, those 14 days, a nurse will be in touch every day. And that is just to monitor your progress, just in case you develop symptoms, and we would then take things from there. That said, if you don't develop symptoms throughout that 14-day period, you should still stay in your home. That's absolutely key. You should wear your mask, wash your hands, and keep your distance from others in your household. So once you've reached the end of that 14-day period, the nurse will again be in touch with you to reassess your current status, and then inform you that you are outside your quarantine period, you're free to leave your home and return to work. At that point, you should also inform your physician, who may issue a fit-to-work letter, as well as your employer insurance. Again, importantly, we are not doing any retesting, any testing at all for quarantine contacts, either at the beginning or at the end of the quarantine period.
Thank you, Dr. Bowman. This is Ask CPS. Please stay tuned.
You ever hear earthquake call and say, "Hello, Mr. Mara, it's me, earthquake, coming in Tuesday around 10. No, sir. Earthquake does arrive unannounced, and when it comes, it'll shake all the sense and the sensibility out of we. Remain calm, stay inside, and do the DCH. Drop, cover, hold on. Once the shaking start and you know it's an earthquake, make a quick move to a safe place. Don't run to the doorway or any exit, and the stairs that may be broke up or even full of people. Elevator, avoid that because you might get in and then poof, power gone, and you're stuck in a box without air. Take cover under a strong table or a bed, or crouch against an inside wall or in a corner and cover your face and your head with your arms. Remember, DCH. Drop, cover, hold on. Glass windows and doors, outside walls in an earthquake, that is bad news. Take care of yourself. Most injuries during earthquakes happen when something drops and hit people entering or exiting a building. Last thing, don't bother run outside and ask, "You feel it? You feel it?" Remain calm, stay indoors until all the shaking stop and do the DCH. Drop, cover, hold on.
This public service announcement was brought to you by Sedima and the government of St. Martin. The following public service announcement brings to you a few of the many unsung heroes in the medical profession who are working tirelessly to put our needs ahead of theirs and in the midst of this battle to prevent the spread of COVID-19. Listen closely to their message so that we all can remain safe.
Good day, St. Martin. My name is Emiko Birdlake, cardiologist here at St. Martin Medical Center. We are now in a medical crisis and we need you to help save lives. So we're asking you to please stay at home, bond with each other. Please help us save all the lives possible. Stay at home.
Hi, I'm Nurse Moni Gomes, a registered nurse at the St. Martin Medical Center. I am here to tell you all, remember the number 1 step, wash your hands, and number 2, stay at home.
This public service announcement is brought to you by the St. Martin Medical Center and the government of St. Martin.
El COVID-19 se puede transmitir de persona a persona. Por eso, para mantenerse seguro, hay que conservar una distancia de por lo menos 2 metros o 6 pies de otra persona. No besos, no abrazos y no dar la mano. Este mensaje lo trae el Servicio de Prevención de la Comunidad.
Welcome back to Ask CPS. We have Dr. Sana Van Kampen with us. Sana, who are CPS currently testing?
Thanks, Janine. So we're currently testing people with symptoms of COVID only. Unfortunately, we do not have the capacity to test the whole island, so we have to prioritize. And the reason that we focus on people with symptoms is because these people have the most chance of spreading the virus. So the virus is present in the nose and throat of people infected with COVID, and there it produces cold and flu-like symptoms. So people start to cough or sneeze, and this is the way they can infect others. So if people are not showing any of these symptoms, there is only a low chance they spread the virus. So this is why we recommend and keep on recommending everyone to keep their distance, wash their hands regularly, and wear their masks.
Okay. Why are we not testing people in quarantine, Sana?
Yes. So a person in quarantine is someone who has had close contact with someone with COVID-19, but is not showing any signs of symptoms as yet. It can take up to 14 days for this person to show any signs and symptoms and become ill. If we, however, test too early in their infection, the test may not pick up the virus yet, and the result will be false negative. So we have to wait for these 14 days to see whether they were infected or not. And if the person shows no signs and symptoms during this period, he or she is allowed to leave the house again.
Okay. Do you retest people at the end of the isolation period, Sana?
So people who have an infection with COVID-19, they are requested to isolate for 14 days from the day their symptoms started. So on average, people with the virus recover within a week. And all people recover within 14 days unless they are severely ill, need to be hospitalized, or they are immunocompromised, like people with HIV. So if people are free of symptoms for 3 days, they are no longer infectious and they're no longer a risk for others. So after 14 days of isolation, we can safely say that people are not infectious anymore and they can leave the house again. We are not retesting people at this point because there is really no reason to test them. Moreover, a person who's recovered from COVID may still have virus particles in their body. These particles are harmless and these people cannot spread the virus anymore. However, the test will pick up this virus and will give a false positive result. So these virus particles can stay in your body for up to 3 months after diagnosis. If we retest someone within these 3 months, we may get a false positive result. So that is why we recommend not to be retested after you've had COVID and to remain in isolation for 14 days.
Thank you, Dr. Sana Van Kampen. Bonjour, bonsoir, communauté haïtienne. Nous devons faire nous changer pour nous laver mais nous continuer kembe distance nous à démettre avec servir masque. Merci. You're watching Ask CPS. My name is Jeanine Chatelier and I'll see you next time.